Your cells are aging right now, not simply through the passage of time, but through active damage to your DNA, mitochondria, and cellular repair mechanisms that accelerates when you fail to sleep adequately. Sleep is not a passive state where your body simply shuts down for rest. It is an active biological process during which critical maintenance functions occur that cannot happen efficiently when you are awake. During deep sleep, your brain clears toxic metabolic waste through the lymphatic system, your immune system consolidates memory of pathogens and produces antibodies, your growth hormone levels surge to repair damaged tissues, and your cells activate autophagy programs that remove dysfunctional proteins and organelles. These processes are essential for longevity, and they are profoundly disrupted when sleep is insufficient in either duration or quality. The damage accumulates silently over months and years, manifesting initially as subtle changes in metabolism, immune function, and cognitive performance before progressing to measurable increases in disease risk and mortality. Sleep deprivation has become normalized in modern society. Millions of people routinely sleep fewer than 6 hours per night, viewing sleep as a luxury they cannot afford given work demands, social obligations, or entertainment options available at all hours. The pervasive belief that sleep is optional or that lost sleep can be recovered through weekend catch-up sleep has created a population chronically operating in a state of sleep deficit. What the research demonstrates clearly is that inadequate sleep is not simply causing fatigue or reduced productivity, it is actively shortening lifespan through multiple biological mechanisms that accelerate aging, impair disease resistance, and increase risk of the conditions that kill most people in developed nations, including cardiovascular disease, cancer, dementia, and metabolic disorders. The relationship between sleep duration and mortality follows a clear dose-response pattern. Sleeping fewer than 7 hours per night is associated with significantly increased all-cause mortality, and the risk increases progressively as sleep duration decreases. This is not correlational noise, it represents actual biological damage that accumulates when the essential maintenance functions of sleep are chronically abbreviated. I am Dr. Alex, an emergency medicine physician with nearly a decade of experience treating acute medical emergencies. In the emergency department, I frequently encounter patients experiencing heart attacks, strokes, severe infections, and metabolic crises whose medical histories reveal patterns of chronic sleep deprivation. These patients often report sleeping 5 or 6 hours nightly for years or decades, viewing this as necessary for their careers or lifestyles. They are surprised when informed that their sleep patterns likely contributed to the acute event that brought them to hospital. The connection between sleep and longevity is supported by extensive epidemiological data and mechanistic research that has clarified precisely how insufficient sleep damages biological systems. My objective is to help individuals understand the specific pathways through which poor sleep shortens lifespan so they can make informed decisions about sleep prioritization before irreversible damage occurs. Over the next several minutes, I will explain the mechanisms linking sleep deprivation to premature mortality, identify the sleep disruptions that are most harmful, and provide evidence-based guidance for optimizing sleep to maximize health span and lifespan. Before examining how poor sleep shortens life, we must understand what occurs during normal sleep. Sleep is organized into cycles lasting approximately 90 minutes, each consisting of distinct stages with specific physiological functions. Non-rapid eye movement sleep, or NREM sleep, includes 3 stages ranging from light sleep to deep slow-wave sleep. During deep NREM sleep, your brain exhibits high-amplitude, low-frequency electrical activity, your heart rate and blood pressure decrease to their lowest levels, and growth hormone secretion reaches its peak. This is when physical restoration occurs most intensively. Damaged tissues are repaired, muscle is built, bone density is maintained, and immune system cells proliferate and mature. Rapid eye movement sleep, or REM sleep, is characterized by intense brain activity, similar to wakefulness, muscle paralysis except for the eyes and diaphragm, and vivid dreaming. REM sleep is critical for memory consolidation, emotional regulation, and synaptic pruning, where unnecessary neural connections are eliminated to maintain cognitive efficiency. The architecture of these sleep stages changes throughout the night. The first half of the night is dominated by deep NREM sleep, which is when the most restorative physical processes occur. The second half contains proportionally more REM sleep, which supports cognitive and emotional functions. When sleep duration is reduced, you lose disproportionate amounts of REM sleep because it concentrates in the later sleep cycles that are eliminated when you wake early. When sleep quality is poor due to fragmentation or sleep disorders, you spend less time in deep NREM sleep because arousals repeatedly bump you into lighter stages. Both scenarios prevent the completion of essential maintenance functions, and the deficit accumulates with each inadequate night. What becomes clear when you understand sleep architecture is that the commonly reported 6 hours of sleep is not simply 1 hour less than 7 hours. It represents the complete loss of the final 90-minute sleep cycle, which contains the highest proportion of REM sleep, and the last opportunity for deep NREM sleep. That lost cycle contains critical biological processes that cannot be compressed into the earlier sleep time. The first mechanism through which poor sleep shortens lifespan involves the cardiovascular system. During sleep, your blood pressure decreases by 10 to 20% compared to waking levels, a phenomenon called nocturnal dipping. This blood pressure reduction is essential for cardiovascular health because it provides your heart and blood vessels with a recovery period from the mechanical stress of daytime pressure. When sleep is insufficient or fragmented, nocturnal dipping is blunted or absent, meaning your cardiovascular system remains under elevated pressure for 24 hours daily. This chronic pressure exposure accelerates atherosclerosis, promotes left ventricular hypertrophy, where the heart muscle thickens abnormally, and increases risk of arrhythmias. Epidemiological studies have consistently demonstrated that individuals sleeping fewer than 6 hours per night have significantly increased risk of hypertension, and the relationship persists after controlling for obesity, diabetes, and other cardiovascular risk factors. Sleep deprivation also disrupts autonomic nervous system balance, increasing sympathetic nervous system activity while reducing parasympathetic activity. This creates a state of chronic physiological arousal, where heart rate remains elevated, blood vessels remain constricted, and the heart has to work harder continuously. The inflammatory markers associated with cardiovascular disease, including C-reactive protein, interleukin-6, and tumor necrosis factor alpha, are all elevated in sleep-deprived individuals. This chronic inflammation promotes endothelial dysfunction, destabilizes atherosclerotic plaques, and increases thrombotic risk. The combination of elevated blood pressure, increased sympathetic tone, chronic inflammation, and impaired vascular function creates a perfect environment for acute cardiovascular events. Large prospective studies have found that sleeping fewer than 6 hours per night increases risk of heart attack by 48% and stroke by 15% compared to sleeping 7 to 8 hours. These are not modest associations, they represent substantial increases in the events that are leading causes of death globally. The second mechanism involves metabolic dysregulation. Sleep deprivation profoundly disrupts glucose metabolism and appetite regulation through hormonal pathways. When you sleep inadequately, your body produces less leptin, which is the satiety hormone that signals fullness, and more ghrelin, which stimulates hunger. This hormonal shift creates increased appetite, particularly for calorie-dense, high-carbohydrate foods. Simultaneously, sleep deprivation impairs insulin sensitivity, meaning your cells respond less effectively to insulin signaling and require more insulin to clear glucose from the bloodstream. Studies have demonstrated that even a single night of 4 hours sleep reduces insulin sensitivity by approximately 25%. When this occurs chronically, it creates a state resembling pre-diabetes where blood glucose remains elevated longer after meals and the pancreas must produce more insulin to compensate. The mechanism involves disruption of the hypothalamic pituitary adrenal axis. Sleep deprivation increases cortisol levels, particularly in the evening when cortisol should be declining to its nadir. Elevated cortisol promotes hepatic glucose production, increases insulin resistance, and stimulates appetite. At the cellular level, sleep deprivation activates inflammatory pathways, including nuclear factor kappa B, which impairs insulin signaling directly. The cumulative effect is that chronic sleep deprivation creates the metabolic profile characteristic of type 2 diabetes, including insulin resistance, elevated fasting glucose, dyslipidemia, and visceral fat accumulation. Prospective studies have found that individuals sleeping fewer than 6 hours nightly have doubled risk of developing diabetes over 10 years compared to those sleeping 7 to 8 hours. The metabolic dysfunction also contributes to obesity, which compounds cardiovascular risk and creates additional pathways through which sleep deprivation shortens lifespan. If you are watching this content, you likely recognize that sleep is important or you are concerned about your own sleep patterns. I commit to providing scientifically rigorous information that will enable you to understand how sleep affects longevity and what interventions can optimize sleep for health. I will continue producing evidence-based content addressing the preventable conditions I encounter in emergency medicine. I request your support through subscribing to this channel. If upon completing this presentation, you conclude the information was not valuable or accurate, you may unsubscribe without obligation. However, if you find this content useful, please engage with the subscribe function to help expand its reach to others who may benefit from understanding these concepts. I appreciate your consideration, and we will proceed with the analysis. The third mechanism through which poor sleep shortens lifespan involves immune dysfunction. Your immune system exhibits strong circadian rhythmicity with distinct functions occurring at different times of day. During sleep, particularly during deep NREM sleep, your body shifts into an anabolic state where immune cells proliferate, mature, and distribute throughout the body. T lymphocytes, which are critical for adaptive immunity and cancer surveillance, undergo clonal expansion during sleep. Natural killer cells, which identify and destroy virally infected cells and cancer cells, increase in number and activity during sleep. Cytokine production, including interleukin-12 and interferon gamma, which coordinate immune responses, peaks during sleep. When sleep is restricted, these processes are curtailed. Studies have demonstrated that individuals sleeping fewer than 7 hours per night have nearly 3 times the risk of developing a cold when exposed to rhinovirus compared to those sleeping 8 hours or more. The impaired immune function is not limited to minor infections. It affects cancer surveillance as well. The mechanism involves disruption of circadian clock genes that regulate cell cycle progression and apoptosis, which is programmed cell death. When these regulatory mechanisms are disrupted by chronic sleep deprivation, cells with DNA damage that should be eliminated through apoptosis may instead continue dividing, increasing cancer risk. Epidemiological studies have found associations between short sleep duration and increased incidence of several cancer types, including breast, prostate, and colorectal cancer. Shift workers who experience chronic circadian disruption have elevated cancer rates that have led the International Agency for Research on Cancer to classify shift work involving circadian disruption as a probable carcinogen. The immune dysfunction from poor sleep also impairs response to vaccinations. Research has shown that sleep-deprived individuals produce 50% fewer antibodies in response to hepatitis B vaccination compared to well-rested individuals. This has profound implications for disease resistance and longevity because impaired immune function increases susceptibility to infections, reduces cancer surveillance, and accelerates immune system aging. The fourth mechanism involves neurodegeneration and cognitive decline. During sleep, your brain activates the glymphatic system, which is a waste clearance pathway that removes metabolic byproducts accumulated during waking activity. The glymphatic system functions primarily during sleep when neuronal activity decreases and the space between brain cells expands by approximately 60%, allowing cerebrospinal fluid to flow through brain tissue and carry away waste products. One of the key substances cleared through this system is beta amyloid, which is the protein that accumulates in Alzheimer's disease. When sleep is insufficient, beta amyloid clearance is impaired and the protein begins accumulating in brain regions involved in memory formation. Studies using PET imaging have demonstrated that even a single night of sleep deprivation increases beta amyloid burden in the brain, and chronic sleep deprivation leads to progressive accumulation. The relationship between sleep and dementia risk is well established. Prospective studies following individuals for decades have found that sleeping fewer than 6 hours per night in midlife is associated with 30% increased risk of developing dementia late life. The mechanism extends beyond beta amyloid accumulation. Sleep deprivation also impairs tau protein clearance, promotes neuroinflammation, disrupts blood-brain barrier integrity, and reduces neuroplasticity. These processes accelerate brain aging and cognitive decline. Shorter sleep duration is associated with faster rates of brain atrophy in regions including the hippocampus and frontal cortex. The cognitive impairment manifests gradually as deficits in memory, attention, executive function, and processing speed. By the time dementia is diagnosed, substantial irreversible damage has occurred. The implication for longevity is direct. Because dementia dramatically reduces quality of life, increases mortality risk, and represents one of the most feared outcomes of aging. The fact that chronic sleep deprivation actively promotes neurodegeneration through impaired waste clearance and multiple additional pathways means that optimizing sleep is one of the most effective interventions for preserving cognitive function and preventing dementia. The fifth mechanism involves cellular aging measured through telomere length and epigenetic age. Telomeres are protective caps on the ends of chromosomes that shorten with each cell division. When telomeres become critically short, cells enter senescence or die, which is a fundamental mechanism of aging. Sleep deprivation accelerates telomere shortening through increased oxidative stress and inflammation. Studies have found that individuals sleeping fewer than 7 hours per night have significantly shorter telomeres compared to those sleeping 7 to 9 hours, with the effect size equivalent to several years of biological aging. The relationship persists across cell types including leukocytes, which are commonly measured, and likely reflects systemic acceleration of cellular aging. Epigenetic age, which is calculated from DNA methylation patterns and predicts mortality more accurately than chronological age, is also affected by sleep. Research has demonstrated that chronic sleep deprivation is associated with accelerated epigenetic aging, meaning that sleep-deprived individuals are biologically older than their chronological age would suggest. The mechanism involves dysregulation of circadian clock genes that control DNA repair, mitochondrial function, and cellular stress responses. When these regulatory systems are disrupted by inadequate sleep, cells accumulate damage more rapidly and repair less efficiently. The acceleration of cellular aging manifests systemically as earlier onset of age-related diseases, reduced physiological reserve, and decreased lifespan. This is perhaps the most fundamental pathway linking sleep to longevity because it affects the basic biology of aging rather than simply increasing risk of specific diseases. The sixth mechanism involves increased all-cause mortality through accident and injury risk. Sleep deprivation impairs reaction time, judgment, and attention to a degree comparable to alcohol intoxication. Individuals who have slept fewer than 6 hours have reaction times and cognitive performance equivalent to someone with a blood alcohol concentration of 0.1%, which exceeds the legal limit for driving in most jurisdictions. This impairment substantially increases risk of motor vehicle accidents, occupational injuries, and other traumatic events that are leading causes of death, particularly in younger populations. The National Highway Traffic Safety Administration estimates that drowsy driving causes more than 100,000 crashes annually in the United States alone, resulting in thousands of deaths. The risk increases exponentially with the degree of sleep deprivation, and even individuals who do not feel subjectively sleepy demonstrate measurable impairment in performance tasks. Beyond acute injury risk, sleep deprivation impairs decision-making capacity and increases risk-taking behavior. This affects health decisions including medication adherence, dietary choices, and engagement in preventive care. Sleep-deprived individuals are less likely to exercise, more likely to consume unhealthy foods, and less likely to follow medical recommendations. These behavioral pathways compound the direct physiological effects of sleep deprivation on longevity. The cumulative impact of increased accident risk, poor health decisions, and impaired functioning represents an additional mechanism through which chronic sleep deprivation shortens lifespan that is distinct from the metabolic, cardiovascular, and neurological pathways previously described. Understanding these mechanisms clarifies what interventions optimize sleep for longevity. Sleep quality and duration improve when you address the factors disrupting sleep architecture, while providing the conditions that support natural circadian rhythms and sleep drive. This occurs through several approaches. Maintaining consistent sleep and wake times, including weekends, stabilizes your circadian rhythm and improves sleep efficiency. The suprachiasmatic nucleus, which is your master circadian clock, entrains to consistent timing, and irregular schedules disrupt this entrainment, leading to poor sleep quality even when adequate time is allocated. Optimizing the sleep environment by ensuring complete darkness, reducing ambient temperature to approximately 18 degrees Celsius, and minimizing noise creates conditions that support deep sleep stages. Darkness is particularly critical because even small amounts of light exposure during sleep suppress melatonin production and reduce sleep quality. Avoiding blue light exposure from electronic devices in the 2 hours before bedtime prevents the suppression of melatonin that delays sleep onset and reduces sleep duration. Blue light is most potent at suppressing melatonin, and the screens on phones, tablets, and computers emit substantial blue light wavelengths. Managing caffeine intake by avoiding consumption after early afternoon prevents the adenosine receptor antagonism that impairs sleep initiation and reduces deep sleep even when you are able to fall asleep. Caffeine has a half-life of 5 to 6 hours, meaning that caffeine consumed at 2 in the afternoon still has significant levels circulating at bedtime. Regular physical activity improves sleep quality through multiple mechanisms, including increased adenosine accumulation, improved glucose regulation, and reduced anxiety, but exercise should be completed at least 3 hours before bedtime because the acute arousing effects can delay sleep onset. Limiting alcohol consumption is critical because although alcohol may reduce sleep latency initially, it severely disrupts sleep architecture by suppressing REM sleep and increasing sleep fragmentation. As alcohol is metabolized during the night, withdrawal effects cause arousals that fragment sleep and prevent the restorative processes that occur during consolidated sleep. Managing stress through cognitive behavioral techniques, meditation, or other relaxation practices reduces the hyperarousal that is a primary cause of insomnia. Chronic stress activates the hypothalamic pituitary adrenal axis and increases cortisol, which is directly antagonistic to sleep initiation and maintenance. Addressing sleep disorders, including obstructive sleep apnea, restless leg syndrome, and circadian rhythm disorders through medical evaluation and treatment is essential because these conditions prevent restorative sleep regardless of behavioral interventions. In emergency medicine, I observe the acute manifestations of chronic sleep deprivation when patients present with cardiovascular events, metabolic crises, severe infections, and trauma resulting from impaired cognition and reaction time. These presentations often occur in individuals who have been sleeping inadequately for years or decades without recognizing the cumulative health impact. The patients who prioritize sleep and maintain healthy sleep patterns are those who understand that sleep is not optional or a luxury, but a biological necessity equivalent to nutrition and physical activity. They structure their lives to protect sleep time, recognize that productivity and health depend on adequate rest, and make sleep a non-negotiable component of their daily routine. The clinical distinction between patients who maintain healthy sleep patterns and those who experience chronic sleep deprivation often relates to how they conceptualize sleep. Those who view sleep as wasted time or as something to minimize in favor of work, entertainment, or social activities experience the cumulative health consequences of that prioritization. Those who understand that sleep is when essential maintenance occurs, that health and cognitive function depend on adequate rest, and that lost sleep cannot be fully recovered, make different choices about how they allocate their time. The physiology is unambiguous. The body requires 7 to 9 hours of quality sleep nightly for optimal function and longevity. Attempting to operate on less may seem sustainable in the short term, but the biological damage accumulates silently until it manifests as disease, cognitive decline, or premature death. The question initially posed was how poor sleep shortens lifespan. The answer is that inadequate sleep accelerates mortality through 6 distinct mechanisms that have been characterized through extensive research. Poor sleep increases cardiovascular disease risk through elevated blood pressure, chronic sympathetic activation, and increased inflammation. It impairs glucose metabolism and promotes insulin resistance, creating increased diabetes and obesity risk. It compromises immune function, reducing infection resistance and cancer surveillance. It accelerates neurodegeneration through impaired waste clearance and promotes dementia development. It speeds cellular aging measured through telomere shortening and epigenetic age acceleration. It increases accidental death risk through impaired cognitive function and reaction time. These pathways operate simultaneously and synergistically, meaning that the cumulative effect of chronic sleep deprivation on mortality exceeds what any single mechanism would produce. The epidemiological data supporting these mechanisms is compelling. Multiple large prospective studies following hundreds of thousands of individuals for decades have consistently found that sleeping fewer than 7 hours per night is associated with increased all-cause mortality. The relationship is dose-dependent, with mortality risk increasing progressively as sleep duration decreases below 7 hours. The effect size is substantial, comparable to other well-recognized risk factors, including obesity, physical inactivity, and smoking. This evidence has led sleep scientists to advocate for public health campaigns addressing sleep deprivation similar to those targeting smoking, with the recognition that chronic sleep loss represents a modifiable risk factor for premature mortality affecting millions of people. Sleep cannot be treated as optional or as something to sacrifice when other demands arise. The biological processes occurring during sleep are essential for survival, and they cannot be compressed or eliminated without consequences. The cultural normalization of sleep deprivation, the glorification of working long hours with minimal rest, and the availability of artificial light and entertainment at all hours have created an environment where chronic sleep loss is epidemic. Reversing this requires individual recognition of sleep's importance and societal changes that support adequate rest. For individuals, this means making sleep a priority equivalent to nutrition and exercise, structuring schedules to allow adequate sleep time, and creating environments that support quality sleep. For society, this requires reconsidering work schedules that require chronic sleep deprivation, limiting shift work, particularly in safety-sensitive occupations, and educating the population about the health consequences of inadequate sleep. The evidence is clear. Poor sleep shortens lifespan through multiple well-characterized biological mechanisms. These effects are not theoretical or based on weak associations. They represent actual physiological damage that accumulates with each inadequate night and manifests as increased disease risk, accelerated aging, and premature death. The solution is equally clear: prioritizing sleep by consistently obtaining 7 to 9 hours of quality sleep per night, addressing factors that disrupt sleep, and treating sleep disorders when present will improve health span and extend lifespan. This is one of the most effective interventions available for preventing the diseases that kill most people in developed nations, and for maintaining cognitive function and quality of life into older age. If this information has clarified your understanding of the relationship between sleep and longevity, I encourage you to subscribe to this channel to support continued production of evidence-based health content. The normalization of sleep deprivation represents a public health crisis that is contributing to the burden of chronic disease and premature mortality. Individuals deserve access to accurate information about the biological necessity of adequate sleep and the specific mechanisms through which sleep deprivation shortens life. Your engagement helps expand the reach of this content to others who may benefit from understanding these concepts. I appreciate your attention and encourage you to prioritize sleep as an essential component of health maintenance and disease prevention.